Have you ever noticed an itchy spot on your skin that just won't go away, no matter how much you try to ignore it? If you're a senior or care for one, this could be more than just a minor irritation. It might be a critical warning sign of something far more serious, like cancer. In this video, we're diving into the alarming truth about how a simple itchy spot could signal a 99% chance of cancer in older adults if ignored, and we'll reveal the must-know early warning signs that could save a life. You need to watch until the end because we're sharing expert insights and actionable steps that every senior and their loved ones need to know to catch these signs early and protect their health before it's too late. Before we begin, I would appreciate it if you like this video, you can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. Sign 1. Persistent itching on the lower legs. For older adults, a persistent itch localized to the lower legs, particularly the shins and calves, can seem like a minor annoyance, easily attributed to aging skin, environmental factors, or even a new pair of socks. However, when this itch persists without a visible rash, dryness, or any identifiable external cause like a new soap, lotion, or detergent, it warrants closer attention. This specific symptom has been increasingly recognized as a potential early warning sign of blood-related cancers, particularly lymphomas such as Hodgkin's or non-Hodgkin's lymphoma. Unlike typical skin irritation, this itch is relentless, often intensifying at night, and remains unresponsive to standard remedies like moisturizers or antihistamines. The underlying mechanism linking this symptom to lymphoma lies in the disease's impact on the body's immune and lymphatic systems. Lymphomas originate in the lymphatic system, a critical network responsible for immune defense and fluid balance. As cancerous lymphocytes multiply, they release inflammatory chemicals known as cytokines into the bloodstream. These cytokines can irritate nerve endings beneath the skin, triggering a deep, often burning or prickling sensation that feels distinct from surface-level itching. The lower legs, with their dense network of sensory nerves and relatively thin skin, seem particularly susceptible to this phenomenon. The itch is not merely a skin-deep irritation but a signal of systemic inflammation driven by the cancer's activity. Consider the case of George, a 75-year-old retiree who shared his experience at a cancer awareness seminar. For nearly 6 months, his only symptom was an unrelenting itch on the fronts of his lower legs. Initially, he dismissed it as a quirk of aging or perhaps a reaction to his laundry detergent. His primary care physician prescribed a steroid cream for suspected eczema, but the itch persisted, growing more intense at night and disrupting his sleep. It wasn't until routine blood work revealed abnormal white blood cell counts that further investigation, including imaging scans, uncovered enlarged lymph nodes in his chest, a hallmark of lymphoma. For George, that persistent itch was the earliest clue, predating other symptoms like fatigue or night sweats by months. This pattern is not uncommon. Medical literature and patient anecdotes increasingly highlight persistent, unexplained itching as a paraneoplastic symptom, a sign caused by the body's reaction to a tumor rather than the tumor itself. In lymphomas, this itch can precede more overt symptoms like swollen lymph nodes, fever, or weight loss, making it a critical early signal. For older adults, whose bodies may not always present clear or dramatic symptoms, this subtlety is particularly significant. Aging can dampen the body's ability to send obvious distress signals, and deep-seated cancers like lymphoma may remain hidden until advanced stages. The itch, though seemingly trivial, can be the body's way of whispering that something is amiss. If you or a loved one experiences this kind of itch, persistent, localized to the lower legs, unresponsive to creams, and lacking a visible cause, don't dismiss it. Especially if accompanied by other subtle signs like night sweats, unexplained fatigue, or weight loss, it's worth discussing with a healthcare provider. Request blood work to check for abnormal lymphocyte counts or inflammatory markers, and don't hesitate to mention the itch's duration and intensity. Early detection of lymphoma can significantly improve outcomes, and listening to these quiet signals could be life-saving. Sign 2. Itching between the shoulder blades or upper back. Another often overlooked symptom in older adults is a persistent, deep itch localized between the shoulder blades or across the upper back. This itch, which feels as though it originates beneath the skin rather than on its surface, is frequently dismissed as a result of dry air, poor posture, or irritation from clothing. However, when this sensation persists for weeks or months without relief from topical treatments, it may point to a more serious underlying condition, notably pancreatic cancer. Strikingly, this itch can emerge long before more recognizable symptoms like abdominal pain, jaundice, or digestive issues, making it a critical early clue. The connection between pancreatic cancer and upper back itching is rooted in the disease's impact on the body's bile drainage system. Pancreatic tumors, even small ones, can compress or obstruct the bile ducts, which carry bile from the liver and gallbladder to the small intestine for digestion. When these ducts are blocked, bile salts and other compounds like bilirubin accumulate in the bloodstream. These substances are highly irritating to nerve endings, particularly in areas with dense sensory nerve networks, such as the upper back. The result is a deep, nagging itch that feels almost internal, often described as a crawling or burning sensation that no amount of scratching can relieve. A compelling example is Linda, a 70-year-old woman who experienced what she called a phantom itch between her shoulder blades. For months, she woke up nightly, scratching furiously at her upper back. She tried everything: lotions, oatmeal baths, even a new mattress, assuming the issue was external. The itch, however, remained stubbornly persistent, feeling as though it came from deep within her body. During a routine checkup prompted by mild fatigue, her doctor ordered blood tests that revealed elevated liver enzymes. This finding led to imaging studies, which uncovered a small tumor in the head of her pancreas pressing on her bile duct. The itch, it turned out, was her body's earliest warning sign, long before she developed pain or the classic jaundice associated with pancreatic cancer. This symptom specificity, its focus in the upper back or between the shoulder blades, sets it apart from generalized itching caused by dry skin or allergies. Pancreatic cancer-related itching tends to be localized and unrelenting, often worsening at night and resisting conventional treatments. In some cases, it may be accompanied by other subtle signs of bile duct obstruction, such as darker urine, pale or clay-colored stools, or unexplained fatigue. These symptoms reflect the systemic effects of bile salt buildup and liver dysfunction, even when the tumor itself is still small. For older adults, recognizing and acting on this symptom is crucial. Pancreatic cancer is notoriously difficult to detect early, as it often grows silently until it reaches advanced stages. The upper back itch, though subtle, can serve as a rare window into early diagnosis. If you experience this kind of persistent, deep itching, particularly if it's localized and unresponsive to moisturizers or antihistamines, consult a doctor. Be sure to mention the itch's specific location and duration, and ask about tests like liver function panels or imaging studies, such as an ultrasound or CT scan, to investigate potential bile duct issues. Pairing this symptom with others, like changes in urine or stool color, can further guide diagnostic efforts. If you're still watching this video and finding these insights valuable, please comment number 1 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Why these symptoms matter for older adults. Both lower leg and upper back itching highlight a broader truth about aging and health. The body's warning signs become less obvious with age. Older adults may not experience the sharp pains or dramatic symptoms that younger individuals might, and conditions like lymphoma or pancreatic cancer can remain hidden until they've progressed significantly. These subtle itches, persistent, deep, and unresponsive to treatment, are the body's way of signaling trouble, often long before more alarming symptoms emerge. Awareness and proactive communication with healthcare providers are key. Older adults may hesitate to mention minor complaints like itching, fearing they're overreacting or wasting a doctor's time. But the body is wiser than we often give it credit for, and these persistent signals deserve attention. When discussing symptoms with a doctor, be specific about the itch's location, duration, and lack of response to remedies. Request appropriate tests, such as blood work for lymphoma markers or liver function tests for bile duct issues, and don't be afraid to advocate for imaging if the itch persists without explanation. In both George's and Linda's cases, early action made a difference. George's lymphoma was caught at a stage where treatment was still highly effective, and Linda's early-stage pancreatic tumor allowed for surgical intervention that extended her life. These stories underscore the importance of listening to the body's whispers, those quiet, nagging symptoms that might seem trivial but could point to something serious. For older adults, staying vigilant and speaking up about persistent itching, especially in these specific areas, could be the key to catching a hidden cancer early, when treatment options are most effective. Sign 3. Itchy scalp without visible flakes or dandruff. An itchy scalp can seem like a minor annoyance, something easily dismissed as a byproduct of dry air, aging skin, or an ill-suited shampoo. For older adults, especially those over 60, occasional scalp discomfort might feel like just another quirk of getting older. After all, skin tends to thin and lose moisture with age, and environmental factors like low humidity or harsh hair products can exacerbate irritation. But when the itch becomes relentless, day after day, week after week, with no visible signs of dandruff, redness, or flaking, it could be a subtle but critical signal of something more serious brewing beneath the surface. In rare cases, this persistent itch may point to underlying conditions such as blood-related cancers like leukemia or even skin cancers affecting the scalp. What sets this type of itch apart from typical scalp irritation is its distinct nature. It's not just a surface-level dryness that a quick rinse or moisturizing oil can resolve. Instead, it often manifests as a tingling, crawling, or even burning sensation that feels deeper, almost as if it's coming from within the scalp itself. The itch may shift locations, flitting from one spot to another without a clear pattern, or it might stubbornly linger in a single area. Unlike common scalp issues, it tends to resist standard treatments. Anti-dandruff shampoos, hydrating conditioners, or soothing scalp serums often provide little to no relief. This resistance is a key red flag, especially for older adults, as it may indicate an underlying systemic issue rather than a localized skin problem. In some cases, this persistent itch can be linked to abnormal immune activity, particularly in blood-related cancers like leukemia. Leukemia, a cancer of the blood and bone marrow, involves the uncontrolled proliferation of white blood cells. These abnormal cells can disrupt the body's inflammatory responses, sometimes triggering nerve irritation that manifests as an unexplained itch. For example, chronic lymphocytic leukemia, CLL, which is more common in older adults, can present with subtle symptoms like itching long before more obvious signs, such as swollen lymph nodes or extreme fatigue, become apparent. The scalp, with its rich network of nerves and blood vessels, can act as an early warning system for these internal changes. Consider the case of Henry, a 73-year-old retiree who began noticing an unusual itch on his scalp every afternoon. At first, he attributed it to his shampoo, switching to a gentler, fragrance-free formula. When that didn't help, he wondered if his favorite wool cap was the culprit and stopped wearing it altogether. Yet the itch persisted, a nagging sensation that seemed to defy logic. It wasn't flaky, red, or visibly irritated, just persistently itchy. Months later, during a routine checkup prompted by increasing fatigue, Henry's doctor ordered a complete blood count, CBC. The results revealed an abnormally high white blood cell count, which led to a bone marrow biopsy. The diagnosis: early-stage chronic lymphocytic leukemia. In hindsight, Henry realized his scalp itch had been the earliest clue his body was trying to send. This scenario underscores a critical point. Older adults often experience age-related skin changes, such as dryness or sensitivity, which can make an itchy scalp seem unremarkable. But cancer-related itching is different. It's stubborn, unrelenting, and often feels disconnected from any obvious external cause. No amount of moisturizing cream, medicated shampoo, or lifestyle tweak seems to make a dent. This persistence is what makes it worth paying attention to, especially when paired with other vague symptoms like unexplained fatigue, easy bruising, or a general sense of feeling off. Beyond leukemia, another potential culprit is skin cancer, particularly in older adults with thinning hair or sun-exposed scalps. Basal cell carcinoma, squamous cell carcinoma, or even melanoma can begin as a small, itchy patch that looks deceptively benign, perhaps like a dry spot or a minor bump. The scalp's unique environment, often shielded by hair but exposed to years of ultraviolet, UV, radiation in balding areas, makes it a prime site for these malignancies. Unlike typical skin irritations, cancer-related itching tends to localize in one spot and persist, sometimes accompanied by subtle changes like a slight roughness or a barely noticeable lesion. Because the scalp is difficult to inspect on your own, especially in areas with hair, it's easy to miss these early signs. For this reason, regular scalp checks are crucial, particularly for those over 60. Enlisting the help of a spouse, caregiver, or even a hairdresser to examine the scalp under good lighting can make all the difference. A hairdresser, in particular, may notice changes during routine cuts or styling. Small patches of thickened skin, unusual bumps, or persistent irritation that might otherwise go undetected. If an itch persists for weeks, especially in the same spot, and doesn't respond to over-the-counter remedies, it's time to consult a dermatologist or primary care provider. They may recommend a biopsy or imaging to rule out serious conditions. It's also worth noting that an itchy scalp can occasionally signal other systemic issues beyond cancer, such as liver dysfunction or thyroid imbalances, which can also cause nerve-related itching. However, the combination of a stubborn itch with other symptoms, unexplained weight loss, night sweats, or frequent infections, should prompt a thorough medical evaluation. Early detection is key, and the scalp, though often overlooked, can be one of the body's earliest messengers. Don't ignore a small, stubborn itch. It might be telling a much bigger story. Sign 4. Localized itching on the chest or breast area. When older adults, especially women, but also men, notice persistent itching on the chest or breast area, particularly around the nipple or just beneath the breast, it can be easy to attribute it to sweat, a snug shirt, or even age-related skin thinning. But this specific area is one of the most overlooked spots where itching may signal something far more serious: inflammatory breast cancer or other underlying tumors near the chest wall. What makes this sign unique is that it often shows up before any lump does. The skin might feel warm, irritated, or tight. Sometimes there's a change in texture, slightly rough, thicker than normal, or with a reddish tint. But just as often, there's nothing to see, only a deep, persistent itch that never seems to go away, no matter what cream or lotion is applied. I recall the story of Ruth, 69, who noticed an odd itching sensation around her right breast. She tried switching bras, different detergents, and even went without a bra for a while, thinking it was friction. But the itching continued, in the same spot every day. When she finally went in for a checkup, her doctor noted slight skin dimpling and ordered further tests. What they found was a small but aggressive tumor growing close to the skin surface without the typical round lump most people expect. This is one of the reasons inflammatory breast cancer can be so dangerous. It doesn't always follow the rules. It can mimic a skin rash, can spread quickly, and the earliest symptom is often not pain but irritation. That's why paying attention to itching that doesn't move around, doesn't ease with moisturizers, and is focused in the same place day after day, is so crucial, especially in the breast or chest area. For men, this can be even easier to miss. Male breast cancer is rare, but it does happen and often goes undetected because the signs don't match what most men think to look for. An itchy patch near the nipple, a small area of thickened skin, or a persistent twinge of discomfort under the chest muscle might not sound dramatic, but for someone in their 60s, 70s, or 80s, it deserves a closer look. And there's more. This kind of itch isn't always about cancer growing in the breast itself. It can also be caused by enlarged lymph nodes under the arms or just below the collarbone, signaling lymphoma or another nearby malignancy. So, if the itch is accompanied by swelling, warmth, or even just a vague sense of heaviness in the area, don't wait. Early detection doesn't start with fancy machines. It starts with awareness, with listening, with noticing the quiet patterns that seem out of place. Because your skin can't speak, but it can signal. And this is one of the most important signals not to ignore. If you're still watching this video and finding these insights valuable, please comment number 2 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. Sign 5. Persistent itching in the anal or genital area. Few sensations are as persistently aggravating and yet frequently dismissed as itching in the anal or genital region. This discomfort, often shrouded in embarrassment, is particularly prevalent among older adults, who may feel reluctant to discuss it with healthcare providers or even acknowledge it to themselves. The awkwardness of the topic, combined with the assumption that such itching is merely a minor irritation, leads many to ignore it for far too long. However, when itching in these sensitive areas becomes chronic, lasting weeks, months, or recurring despite attempts to address it, and lacks an obvious cause such as poor hygiene, a skin reaction, or a temporary infection, it may be a subtle but critical warning sign of a more serious underlying condition. Why persistent itching matters. The anal and genital regions are densely packed with nerve endings, making them highly sensitive to even minor changes in the body. This sensitivity means that persistent itching can serve as an early indicator of internal issues, including potentially life-threatening conditions like anal, vulvar, or penile cancer. These cancers, while relatively rare, are more common in older adults, particularly those over 60, and their early symptoms are often mistaken for benign issues. The danger lies in the deceptive nature of the itch. It can feel like a surface-level annoyance, easily attributed to something as simple as dry skin, irritation from toilet paper, friction from physical activity, or even sensitivity to incontinence pads or soaps. In many cases, these assumptions are correct, and the issue resolves with basic care. But when the itching persists, becomes more intense, or evolves into a raw, burning sensation, it's time to pay closer attention. Chronic itching in these areas can signal abnormal changes in skin cells, inflammation of nerve endings, or even subtle swelling in nearby lymph nodes. Unlike temporary irritation, which typically responds to over-the-counter treatments or lifestyle adjustments, itching associated with serious conditions often resists these interventions. It may worsen at night, disrupting sleep, or become localized to a specific spot, sometimes accompanied by subtle changes in the skin's texture, color, or thickness. These signs, though easy to overlook, can be critical clues to conditions that benefit immensely from early detection. Real-life implications. A case study. Consider the case of Eugene, a 76-year-old retiree who experienced persistent anal itching for nearly a year. Initially, he attributed the discomfort to hemorrhoids, a common issue in older adults. He diligently applied over-the-counter hemorrhoid creams, adjusted his diet to include more fiber, and even tried cold compresses to soothe the irritation. Despite these efforts, the itching persisted, sometimes intensifying to a burning sensation that made sitting uncomfortable. Embarrassed to bring it up, Eugene delayed seeking medical advice, assuming it was a private matter he could manage on his own. It wasn't until his wife urged him to see a doctor that he visited a colorectal specialist. A routine scope exam revealed a small lesion on the wall of his anal canal, which, after a biopsy, was diagnosed as an early-stage anal tumor. Fortunately, because it was caught early, Eugene's treatment was less invasive, and his prognosis was excellent. Had he continued to dismiss the itch, the tumor could have grown undetected, potentially leading to more severe complications. Eugene's story is not unique. Many older adults delay addressing persistent itching due to embarrassment or the belief that it's a trivial issue. Yet, his experience underscores a critical truth. What seems like a minor annoyance can sometimes be the body's way of signaling a problem that requires prompt attention. Specific concerns for women and men. For women, persistent itching in the genital area, particularly around the vulva, can be an early sign of vulvar cancer, a rare but serious condition that becomes more prevalent with age, especially after 60. Vulvar cancer often presents with subtle symptoms, such as itching that doesn't respond to moisturizers, antifungal creams, or other standard treatments. The affected skin may appear slightly discolored, red, white, or darker than usual, or feel rougher, thinner, or more fragile. In some cases, there's no visible lump or growth, which makes the itch even easier to dismiss. Many women attribute these symptoms to postmenopausal changes, such as vaginal dryness or hormonal shifts. And while these are common causes, persistent or worsening itching warrants further investigation. Other red flags include itching that's localized to one side or a specific spot, or sensations that feel deeper than surface-level irritation. For men, chronic itching in the genital area, particularly on the penis or scrotum, can occasionally point to penile cancer, another rare condition. Like vulvar cancer, it may start with itching or irritation that seems minor but persists despite treatment. Changes in skin texture, small sores, or areas of discoloration may accompany the itch, though these signs can be subtle and easily mistaken for dermatitis or a fungal infection. Men with a history of smoking, uncircumcised men, or those with a history of human papillomavirus, HPV, infection may be at higher risk, making it especially important to take persistent symptoms seriously. Why hesitation can be dangerous. The anal and genital regions are not only sensitive but also private, which often leads to hesitation in seeking medical advice. Cultural taboos, fear of embarrassment, or the assumption that it's just aging can prevent people from acting on symptoms that could lead to early detection of serious conditions. Yet, the stakes are high. Anal, vulvar, and penile cancers, when caught early, often have favorable outcomes with less aggressive treatments. For example, early-stage anal cancer may be treated with localized therapies, while advanced cases may require surgery, radiation, or chemotherapy, which carry greater risks and complications. Similarly, vulvar cancer detected in its earliest stages may be managed with minor surgical intervention, while delays can lead to more extensive procedures and a higher risk of spread to lymph nodes. The psychological barrier to discussing these symptoms is significant. particularly for older adults who may feel uncomfortable broaching such topics with their doctors. However, healthcare providers are accustomed to addressing these concerns with professionalism and sensitivity. A simple conversation about persistent itching could lead to a physical exam, a biopsy, or imaging tests that uncover an issue before it becomes life-threatening. If you're still watching this video and finding these insights valuable, please comment number 3 below to let me know you're here. And if you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. Your support helps us continue creating good content to inform and inspire you. Now, let's move forward. When to act and what to do. Not every itch is cause for alarm. Temporary irritation from hygiene products, clothing, or minor infections often resolves with basic care, such as switching to fragrance-free soaps, wearing loose-fitting clothing, or using prescribed antifungal or steroid creams. However, the following signs suggest it's time to consult a healthcare provider. Duration: itching that lasts for weeks or months, or that recurs after seeming to resolve. Resistance to treatment: itching that doesn't improve with over-the-counter creams, moisturizers, or hygiene changes. Associated symptoms: changes in skin appearance, redness, whiteness, thinning, or thickening, a burning sensation, or localized discomfort in one specific area. Nighttime worsening: itching that intensifies at night, disrupting sleep. Other changes: the presence of lumps, sores, or unusual discharge in the affected area. If you experience these symptoms, start by scheduling an appointment with a primary care physician, who may refer you to a specialist such as a dermatologist, colorectal surgeon, or gynecologist, depending on the area affected. Be prepared to describe the duration, intensity, and nature of the itching, as well as any treatments you've tried. While it may feel awkward, providing detailed information can help your doctor determine the appropriate tests, which may include a physical exam, a biopsy of suspicious tissue, or imaging studies like an MRI or CT scan. The power of early detection. The most critical takeaway is this: persistent itching in the anal or genital area should never be dismissed as normal, especially if it's prolonged or unresponsive to basic remedies. Early detection of conditions like anal, vulvar, or penile cancer can dramatically improve outcomes, often allowing for less invasive treatments and a better quality of life. Listening to your body, overcoming the hesitation to speak up, and seeking medical advice can make all the difference. A small, subtle symptom like an itch could be the key to catching something serious before it has a chance to grow. Don't let embarrassment or assumptions stand in the way of your health. Act on the itch, and give yourself the peace of mind that comes with knowing you've taken control. That's it for today's video on the critical early warning signs of cancer in seniors, especially that alarming itchy spot you should never ignore. We hope this has opened your eyes to the importance of staying vigilant about your health or the health of your loved ones. So, tell us, what's one key thing you've learned from this video that you're going to put into practice in your life? Drop it in the comments below. We'd love to hear from you. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more life-saving health tips.